Okay, for this lecture, we're going to be talking a little bit about seizures, different types of seizures and the drugs that we're going to use to treat them. So first of all, you need to understand there are different types of seizures. There's two general categories. One is called partial or focal seizures. Put that over here. Seizures is the whole thing. There's partial or also focal seizures, and there's also generalized. And you can kind of just categorize different, underneath these different types. There's simple partial, and there's complex partial. So simple and complex. And under generalized, there is a lot of different kinds here. And run through them real quick. I'll list them and then we'll talk about them. There's absence, which just looks like absence, which is basically a pretty much definition of what it is. There's myoclonic. There is tonic-clonic. There is tonic. And then lastly, there is atonic. Okay, so let's go first of all through these partial seizures. So partial seizure, this is defined as an effect affecting a single area of the brain. So just a specific part of the brain is being affected, and usually it's going to originate in the medial temporal lobe. So the medial temporal lobe, if you remember the brain, here's a brain for you, and if this is the front of the brain, like here's the eyeballs, the temporal lobe is off here on the side next to the ears. Okay, so think about listening to a tempo with your ears. That's the temporal lobe. Okay, so it's going to be the medial temporal lobe, and it's often preceded by a seizure aura. Okay, and can secondarily generalize. So it can start out as a partial seizure or a focal seizure, and then it can become later on it can turn into a generalized seizure. So there's two types here. There's simple and there's complex. And the only real difference between these is simple is they are conscious, fully conscious, and complex they are not fully conscious. And that's really the only difference here. Okay? So simple conscious, not fully complex, not fully conscious. Now, so let's break up these other ones now. So absence, whatever. Sometimes they call these petit mal seizures. They do this thing called an EEG. It's like measuring your brain waves or something. And when that one, they look at these and you see there's 3 hertz on the EEG, and there's no post-ictal confusion, which means afterwards they're fine, but there's a blank stare. So basically with these people, what we have going on is they zone out for a little while. It's blank stare, and then afterwards they don't really know what happened. But they're fine. I mean, whatever. They're not like messed up or anything, but they just kind of gone from it. It's like they're absent for a little while. Then there's a myoclonic seizure. Now, myoclonic, I think of like muscle when I hear myo, and that's kind of what's happening here. It's just like these quick, repetitive jerks, like your arm, going back really quickly or whatever. Then there's a tonic-clonic. And with this one, they have alternating stiffening and they have movement. So a little bit different there. This one was like more like this quick jerks. Q-U-I-C-K. Wow, okay, that was terrible. Quick jerks. And this one is more of like a stiffening kind of thing. Okay. And then there's the tonic. And that's just where their whole body gets stiff. This one goes from stiff to unstiff. Maybe a good way to say it. And then lastly, the atonic is they just go limp. And a lot of times they think, oh, they passed out. Well, yeah, they passed out, but they passed out because they had a seizure, not because of some other reason. They just fall to the floor. So those are different types of seizures. Now, what about drugs? How are we going to treat these different kinds of seizures? Well, there's a lot of drugs out there for seizures. We'll go through these. So first of all, see, I'll do drugs in red here. When a person has an absence seizure, this one here, the drug you want to give them is ethosuximide. Okay, absence. Just think, oh, it really sucks to be absent, or I don't know, I want to think of it. Or maybe etho, et, that kind of looks like et. So maybe you could think et was absent from his home. That's why he always wanted to call his home. I don't know, whatever works for you. The deal with this one is ethosuximide blocks the calcium channels. Okay, blocks thalamic T-type calcium channels. So maybe, you know, what did he really always want? He wanted to drink a glass of milk. E.T. always wanted milk. So he's absent from his home, wanted some milk, and milk has calcium in it. Okay. What about next drug here I was talking about is benzodiazepines. So benzodiazepine is, you know, kind of second order drug, or excuse me, it is re-erase that. It is first line for an acute status epilepticus. Okay, static epilepticus. You know, it's going to be one of these seizures over here, typically. Really bad ones, tonic-clonic. So, big drug here that we're going to want to use is benzos. So that's going to be first line for acute. So if a person is having a tonic-clonic, you know, epileptic seizure, benzo. I think the way you differentiate a tonic-clonic between a full-on status epilepticus is a status epilepticus lasts like 30 minutes. But if it's really bad here, you're just going to give them benzos. That's going to be first line for the acute treatment. How does this work? It increases GABA A action. Okay, and I believe benzodiazepines work with chlorine channels. So clonic kind of looks like chlorine to me, so maybe you can remember it that way. But people who, this is also clonic kind of looks like a clock, so you could think benzos are nice cars, and maybe you could imagine that little symbol on a Mercedes-Benz kind of looking like a clock. I don't know, whatever you want to think of it. So next drug here we have on the list. Oh, by the way, lorazepam and diazepam are some drugs here, just so you know, types of benzos. Lorazepam, diazepam, kind of nice because they benzodiaz is similar with diazepam, and lorazepam, you see the Ez in there, the Z and the P. It looks similar. Zep has the Zep in it, with along the anyway. So that may help. You can also use these for eclampsia seizures. So eclampsia is this condition sometimes people get, especially like popular situation is when women are having a baby and there's some kind of infection, high pressure or something, call it preeclampsia. Anyway, so you can use this for that as well. Next drug here is phenytoin, and phenytoin has, it's tied for the most uses. It can be used for a lot of different things. You can use phenytoin for simple, so you can use it over here for this type. You can use phenytoin for complex, okay? You can use phenytoin for tonic-clonic. In fact, it is first line for tonic-clonic seizures. But it's not first line for it's not first line acute. First line acute is going to be benzodiazepine. So if a person's having a tonic-clonic seizure right in front of you, you're going to use benzodiazepine. But now that they have it and you're like, okay, we kind of want to like generally stop this from happening anymore, you can give them phenytoin, and that can be first line for that. And it is also first line prophylactic for status epilepticus. In other words, a person has status epilepticus and you don't want them to have seizures anymore. If you give them phenytoin, they may not have seizures anymore. Okay. I don't know why I wrote tonic-clonic there when I meant to write phenytoin, but I'm going to erase that. I'm going to write phenytoin in the place of that. Phenytoin. Okay. Next here is carbamazepine. I might write this out for you so you can see it. Carbamazepine. Okay, that's the word, carbamazepine. And this one is a sodium channel. By the way, I didn't mention, but phenytoin is also a sodium channel with zero order kinetics. So carbamazepine, most of these are sodium channels. You know, I already mentioned that ethosuximide was a calcium, and I mentioned benzodiazepine was a chlorine through GABA. But phenytoin, carbamazepine, sodium. So carbamazepine, this one is actually first line for 3 different situations here. So it is first line for simple. I'm just going to put carb. Put a little star next to it so you know it's first line. Phenytoin could be used, but it's not first line. It's also first line for this one was first line for that. Phenytoin first line there. Yeah, phenytoin can be used for all these situations. Carbamazepine is the first line drug for that. And it's also, it can be used first line for tonic-clonic seizure as well. So I'll put that carb. So really a good drug. In every instance where it's used, being simple, complex, and tonic-clonic, it is first line in all instances. So good thing to remember. But it's only used in those three situations. Next here we have valproic acid. So valproic acid has a lot of uses. It has as many uses as phenytoin, but it's only first line for one thing, and that is a tonic-clonic seizure. Valproic acid. It's really hard to write on this computer. I apologize. Valproic acid. So I'll put a little star there for first line. But you can also use valproic acid for an absence seizure. So I'll just put val next to this now. Put valp. You can use valproic there. You can use valproic acid for simple as well as complex. So far, all the drugs that work for simple also work for complex. That's kind of nice. And that appears to be the trend in all drugs. If any drug works for simple, it also works for complex. Okay, so that's nice. And in fact, if it's first line for one, it'll be first line for the other. So anytime there's one here, it's for both. I'll circle that so that's what that represents. Next drug, or let's see, valproic acid. Also, I mentioned absence. Yes, I did. Okay, good. Next drug here is called gabapentin. And gabapentin is only has 2 indications. It is good for these guys. I'm just going to put it in the middle because it works for both. So gabapentin. Something of note here is I need to go back a little bit, and I apologize for this. I have not been talking about the side effects of these different drugs. So let's do a quick review, and while I do the review, I'm going to bring up the side effects as well. Let's start with ethosuximide. Remember, ethosuximide was our drug over here, ET. Remember, ET drinking the milk, and he's absent from his home, and that helps you remember that the milk is the calcium. There is an adverse effects of this is GI effects, so that means gastrointestinal effects, fatigue, headache, urticaria, and Stevens-Johnson syndrome. Stevens-Johnson syndrome is this horrible rash you get all over your body. Now let's go on to our benzodiazepines for review. Remember benzodiazepines? Those were acute first line. So somebody's having a status epilepticus tonic-clonic seizure right in front of you. You can give them benzodiazepines. It was the GABA A action. And the side effects of this one is it kind of just almost like knocks people out. It's sedation, tolerance. Tolerance means you take it, the more you take it, the less it's going to work. Dependence means you take it once, it's going to make people want to take it more and more, because I guess sometimes like people like feeling kind of knocked out. And it may also cause some respiratory depression. So you want to watch out if somebody is at any sort of risk with that. Next drug for review is phenytoin. Remember, phenytoin had a lot of uses. Phenytoin was used over here for these guys, but it was also used here for the tonic-clonic seizures and status epilepticus. Okay, in fact, it is first-line prophylactic for status epilepticus. In other words, you make it go away. I don't have status epilepticus on here because status epilepticus is basically can be like a tonic-clonic seizure, but it just means you have it for a long time, like 30 minutes. So that's some review, but the negative side effects of phenytoin, it's got quite a bit here. Okay, nystagmus, diplopia, so just think eye problems, ataxia, like difficulty moving, sedation, makes you sleepy, gingival hyperplasia. And that's really a really specific, commonly used adverse effect of phenytoin. Basically, it makes your gums big and weird looking. Hirsutism, another really weird one. For some reason, it makes people grow hair all over their, like women too, like grow hair on their face, facial hair. Peripheral neuropathy, okay, so that has to do with problems with your nerves or whatnot in your arms. Megaloblastic anemia, that's where your red blood cells get really large and you become anemic. Teratogenesis, which means if you take this and you're a mother who's pregnant with a baby, that your baby is going to get something called fetal Phenytoin syndrome, and that's bad. Okay. Another side effect here is SLE-like syndrome, which stands for systemic lupus erythematosus, and that's like an immuno disease. And also, phenytoin is involved with inducing some cytochrome P450 enzymes. I didn't mention specifically which one for this one, but we understand that phenytoin is going to activate, I think it's CYP3A4 for that one, which is the same one that's in rifampin and a bunch of other stuff like that. So phenytoin is pretty commonly understood to have cytochrome P450. And if you don't know what that is, I'd recommend looking it up in the details. But essentially what it does is it affects the metabolism or the breaking down of other drugs that are also metabolized by the same cytochrome P450 stuff. Okay. Another side effect is lymphadenopathy, as well as Stevens-Johnson syndrome. Now, I mentioned Stevens-Johnson syndrome earlier. Do you remember which one that was in reference with? So Stevens-Johnson syndrome was an effect of ethosuximide. And if it helps you remember ethosuximide with that, remember E.T., drinking milk, he's absent from home. Remember the part of the movie, I don't know if you've seen it, where he's like all messed up and pale, and he looks all like he's got a big rash on his body or something. I don't remember all the details, but think about him getting a rash, E.T. getting a rash on his body, that's Stevens-Johnson syndrome. So yeah, lots of stuff there. Last one for phenytoin was osteopenia. And now let's move on to our review. Carbamazepine. Remember we talked about carbamazepine? Lots of things that carbamazepine does. It's first line for all of them. It handled the simple, it handled the complex. It also did tonic-clonic as well, and it was first line for all those. So if a person has, taking some other drug like something that's metabolized by phenytoin, they could take carbamazepine and they would have the same problems, but it would be perfectly good first-line treatment for tonic-clonic seizures. Problems with taking this, though, is, again, similar to phenytoin, which had the diplopia. Carbamazepine also has some diplopia. Blood dyscrasias, and agranulocytosis and aplastic anemia. I won't go into the details of what those mean right now. Liver toxicity, teratogenesis, induction of cytochrome P450 as well, although this one was also a CYP3A4 for it, and as well as a trying to remember here, 2C19, I believe, as well. Has SIADH, which is syndrome of inappropriate antidiuretic hormone, and Stevens-Johnson syndrome as well. So, man, a lot of these are causing Stevens-Johnson syndrome. So far, we have ethosuximide, we have phenytoin, and we have carbamazepine. The only one that really had unique symptoms so far was that phenytoin. So they're going to test on that with that gingival hyperplasia and the hirsutism. That's very unique to phenytoin. Okay, so we're kind of catching up here. Last one on our list here was valproic acid. So remember valproic acid, what was it used for? That's right, simple and complex, as well as tonic-clonic seizures. Lastly, it can be used for absence seizures as well. So valproic acid really does a lot of things, but the only one that's first line for out of all those is going to be the tonic-clonic seizure. So what's the adverse effects of valproic acid? GI distress. Also, there's a rare but fatal hepatotoxicity that can occur. So you want to sometimes measure the LFTs for that, liver function tests like AST, ALT, I believe that's what it's referring to. Neural tube defects. So don't give this to babies. They can get spina bifida if you give them valproic acid. So no for mothers. Do not give to mothers. Tremor, weight gain, contraindicated in pregnancy because of the spina bifida issues here. So good to know. One last thing about valproic acid of note is it's actually also used for bipolar disorders. Interesting. So there you have it with that one. Now we're moving on here. Gabapentin. So gabapentin only has really, one use, and that's the combined partial, focal, simple, and complex seizures. But gabapentin is another one of those ones that it does calcium. Okay. So far we had ethosuximide did calcium, and now we're having carbapentin that does calcium. Okay. Good. It's actually designed as a GABA analog, so that's kind of interesting. So what are the negative side effects of gabapentin? Well, it only has two. They're not as bad as some of the other ones. It doesn't cause Stevens-Johnson syndrome or anything. It's sedation and ataxia. So that's kind of nice. Only two things happen there. Maybe one way you can remember this is GABA kind of sounds like gabbing. So if somebody's gabbing for a long time, you can get really tired or sedated. And ataxic, which means you just kind of stop moving. Okay, so maybe that would help you remember that. Kind of like how I'm talking for a long time. You might be feeling tired from that. This one actually is also interesting. It's used for treating peripheral neuropathy and post-herpetic neuralgia. Meaning, if somebody gets herpes, okay, somebody gets genital herpes and it hurts, because herpes hurts really bad, you can give them gabapentin, and that can help their cankers from their herpes feel better. So gabapentin, okay, got it? Pen. Let me show you how this looks. Gabapen, okay. Pen kind of looks like penis or penis, okay. That can help you remember herpes. All right. Hopefully that'll help you remember that gabapentin works for herpes because it has pen like penis in it. This is genital herpes, type 2, HSV, herpes simplex virus. Okay, phenobarbital is our next one here. So phenobarbital, 3 indications, really just 2. Does partial focus, 1, so we got pheno. This is getting real messy. Phenobarbital. Also, you can use it for tonic-clonic. Wow, lots of uses there. Now, neither of these are first line. Just like the same, gabapentin didn't have anything first line. Phenobarbital doesn't have anything first line. Phenobarbital works by increasing GABA-A action. That's through chlorine. Okay, so that's another one. Phenobarbital is another one of these chlorine ones. So for this one, adverse effects, similar to gabapentin, sedation, but also tolerance. So the more you take it, the more your body's going to tolerate. You have to take more of it. As well as dependence. People take this one, they want to take it more because they like feeling tired, I guess. This one also induces cytochrome P450, and it is CYP3A4 for that one. So far, pretty much all these are CYP3A4 if they have that issue. There's also some cardiorespiratory depression. Now, remember the other one that had cardiorespiratory depression? Benzodiazepines. That one has some respiratory depression as well. So kind of combine. Maybe you can think of the funny Barbie, phenobarbital. This is what the word looks like. Phenobarbital. It's a barbiturate. Okay, so you think barbital. Barbie rides in a benzo. Okay, both have respiratory depression. Maybe they smoke or something. I don't know. Some story you can use to memorize that. Lastly, here we have not lastly, goodness gracious, we got a lot more. I was going to mention though, last thing about this is what it's used for. Phenobarbital, it's used for tonic-clonic, and it's used for partial. And moving on, topiramate. So topiramate is, this one uses sodium. Okay, most of these were sodium, but so far we've talked about 2 that were calcium. Do you remember what they were? Ethosuximide and gabapentin. Good. And chlorine. Chlorine was going to be our benzodiazepines and our phenobarbital, which is kind of interesting. They both have a lot of the same side effects. They're very similar drugs. Kind of link our barbiturates and our benzodiazepines together there. And benzodiazepines, remember, diazepam, lorazepam. What are they used for? Well, very different things, though. That's kind of where the difference. Phenobarbital and benzodiazepines are used for different things. Phenobarbital is not first line for anything. So topiramate, though. Topiramate was our sodium channel. Going back to what we're talking about, topiramate. I'm going to write this out for you. Topiramate. Sodium. Okay. Topiramate. Similar things for this one. Sedation as well. Mental dulling, kidney stones, weight loss. Also used for migraine prevention. Interesting. So again, topiramate. Put it in here. I'm just going to put top here. I'm going to put top over here. Works for both those. Next is lamotrigine. Lamotrigine. So let's write out lamotrigine here. Lamotrigine, one of the first things I think about when I hear lamotrigine is think about how it is good for pregnancy. It's one of those drugs that's good for pregnancy. There's a number of them. Lamotrigine is one. Another one that's good for pregnancy is let's see, sound like levetiracetam. I don't know if I'm saying that right. Levetiracetam. Okay, that's another one that's good for pregnancy. And another one that's good for pregnancy was gabapentin. And it seems like there's one other one that's also good for pregnancy, but it's not coming to me off the top of my head. Just remember, the way I thought I said, a pregnant lady wearing jeans, walking a lamb, and gabbing. And that's kind of how I tied all this together. Drew a little picture. So lamotrigine has a lot of indications, but because it's good for pregnancy, it's a good one to use. If you can't use phenytoin or valproic acid. Remember, valproic acid, bad. You're going to give your baby spina bifida or something if you give them valproic acid. So lamotrigine is a good drug to give to people if they're pregnant or they're in that age category where they might become pregnant. It's also a good replacement for phenytoin in a lot of instances, not in status epilepticus, maybe so much, but for the tonic-clonic seizures. So lamotrigine is another sodium channel gated. Most of these are sodium channel. Side effect of lamotrigine is Stevens-Johnson syndrome. So you got to titrate it slowly to prevent that. Next is the levetiracetam. Let me write that out for you. Levetiracetam. Okay. Levetiracetam is another good replacement for lamotrigine, but it doesn't have as many uses. It's good for tonic-clonic seizures. I forgot. I failed to mention. Oh my goodness, how did I do this? I failed to mention lamotrigine. I didn't write it on here for one. Man, I'm slacking here. I wrote lamo. Okay, lamo is good over there. Lamo is good here. Lamo is also good here, and that's a big deal because what are you going to give somebody who's having absence seizure? If they can't take valproic acid because they're pregnant and they can't take ethosuximide for some random reason. I don't know. But anyway, so lamotrigine is a good drug there for that. Sorry, going back down. Levetiracetam. That's the one we're talking about now. Levetiracetam. They think it might have something to do with GABA and glutamate release. I'm not really sure, but it's only good for a few things. Just for these tonic-clonic, put Levy for this. And also these ones over here. Getting full over here. And 2 drugs left, sorry. Tiagabine, which I don't even really think I want to worry about, and Vigabatrin. And just know those ones are only used over here. So Tiagabine, Tiagabine, and Vigabatrin. Okay, there they are. And that pretty much sums up this whole section here for those drugs. I can talk about barbiturates, benzodiazepines, and non-benzodiazepines later and that sort of thing. But that's it for this lecture, and thank you for watching.